Hi, my name is Kevin Brown. I'm a physical therapist and shoulder pain expert. In this presentation today, I'm going to show you and take you through how to get rid of shoulder pain naturally without medications, injections, or surgery. In this presentation, I'm going to go over common diagnosis, common causes of your shoulder pain, different treatment options, and how to treat the actual cause of your shoulder pain rather than just treating the symptoms. Then we're going to go over what successful treatment looks like. So for diagnosis, the biggest diagnosis that we typically see is called impingement or shoulder impingement. Underneath that, I have rotator cuff tear or biceps, because typically impingement will cause rotator cuff tendonitis, rotator cuff tear, or something to happen that goes wrong with your rotator cuff, and same thing with the biceps. The next diagnosis is frozen shoulder. And the next common diagnosis we see is arthritis. So take you through each of these diagnoses so you kind of get a feel for what they are and see if this sounds similar to kind of what you're going through. For shoulder impingement, it's a pinching or compression of the biceps tendon, rotator cuff, or bursa. And you can see in this picture right here, we have the arm here, which is called the humerus, and then you have your rotator cuff, and you have this bursa. This is this blue thing here. The biceps isn't shown, but it comes up and attaches here, and then you have the acromion and the shoulder, the ball part of the shoulder. Between this ball part of your shoulder and the acromion is this space, and all these tendons and muscles have to fit into that space. And when you have impingement, that space is narrowed, and when you lift your arm overhead, those tendons or that bursa gets caught or stuck. So pain usually occurs when you lift your arm over your head, and this is typically caused by poor posture and mechanics in the shoulder and the shoulder blade. Because when you lift your arm, it's a small ball and the joint of the shoulder is a small ball and socket. When you lift your arm, the muscles that control the shoulder blade have to be able to move it at the same time the arm is lifting up to make sure that space is clear. When that doesn't happen, when the muscles aren't working properly, or when your posture is poor, that space is narrowed and the muscles don't do their job to make that space clear. And what happens is those tissues, whether it's the biceps, the rotator cuff, or the bursa, get pinched. The next diagnosis was frozen shoulder. It's also called adhesive capsulitis. This is an extreme tightening and inflammation of the capsular ligaments. So your shoulder, like I said, is a ball and socket joint. Think of it like a golf ball sitting on a tee, where the golf ball is the ball part and the tee is a socket, and that socket is very small, and there's also a labrum that attaches and deepens that socket. But what attaches that ball to that socket, there are ligaments. And when those ligaments tighten up, it doesn't allow that ball to roll and glide like it should on the socket. And therefore, your range of motion or your motion period is significantly limited. And that's what adhesive capsulitis or frozen shoulder is. It kind of is the same thing as it says. The shoulder gets frozen. It's very hard to move in certain positions, and then because of all the inflammation and that lack of mobility, it kind of clamps down on the joint and causes a lot of pain at rest. So typically you will have pain at rest and significant restriction in your motion. Typically the loss of motion happens first, and then later on you get the pain. And this is a process that can last from 12 to 18 months. It typically happens after some sort of injury or trauma. The injury may be subtle, but it causes the person not to use their shoulder, and there's little inflammation in there, and that inflammation gets worse and worse, and it starts to tighten down on the joint. So that's typically frozen shoulder. Then we have arthritis. Arthritis is simply just a wearing away of the cartilage, whether it's your shoulder joint, knee joint, hip joint, any joint that has cartilage. If that cartilage wears away, that is what we call arthritis. Typically with arthritis, pain is worse in the morning, and it's worse with inactivity. So, if you don't move for a while, if you let your shoulder just sit there, it gets worse. And then once you get moving again and you stretch it out, or you just get a little more blood flow to the area, the symptoms tend to improve. So symptoms are made worse by poor posture, mobility, strength, and mechanics. And that's very important because a lot of people have arthritis, but they don't have symptoms because they have good posture, good mobility, good strength, and good mechanics. So you could take an x-ray, 2 x-rays, both that show the same amount of arthritis. If one person has good motion, good strength, good mobility, and good mechanics, they they're not going to have nearly as much pain. They may not have any pain or loss of function, even though they have the same degree of arthritis. So that's very important. Arthritis is more of a symptom than a real cause of any pain. So the real causes of shoulder pain that we see in the clinic are poor posture, muscular imbalances and tightness, and typically this is tight pecs and upper back. So when your upper back doesn't move or is stiff, it doesn't allow proper motion of the shoulder. And that's really what causes that shoulder pain. Also, weakness in your scapular muscles. Your scapula is your shoulder blade and the rotator cuff. So if the muscles that control your shoulder blade and that control your shoulder are weak and inefficient, that's going to cause pain. And then underneath I have poor mobility, strength, and mechanics. So that's kind of the overall picture. If you're stiff, it's going to cause pain. If you're weak, it's going to cause pain. And if things aren't working properly, the mechanics aren't correct, you're going to have increased pain. So what are your treatment options? So you go to the doctor, you say, I have shoulder pain. What are they going to do? Typically, you're going to get some sort of medication to control inflammation and pain. They may do an x-ray to make sure that there's nothing structurally wrong, no fractures, no breaks, and that'll be able to show the degree of arthritis you have in the joint as well. They may also give you an injection. If you're really inflamed and tight, they'll give you a cortisone injection to help reduce inflammation and pain as well. And then if those don't work, a lot of times they'll do surgery. They may order an MRI to see if there's any structural damage. They may, if there's not any visual structural damage, they may just go what's called cleaning out the joint, which is they just clean out that cartilage or clean out any debris. So surgery is really used for structural damage, whereas medication and injections are used to control pain and inflammation. Your other option for treatment is a combination of manual therapies, exercise, and fitness to correct the actual cause of your shoulder pain and prevent re-injury. So it's very important to note that whatever treatment option you go with, the last one of the combination of manual therapies, exercise, and fitness to correct the cause of your shoulder pain and prevent re-injury is needed regardless. So even if you take medication and your pain goes away, you still need to correct the cause of your pain. Because just because the pain goes away momentarily, it's going to come back if you don't fix the cause. Same thing with an injection. A lot of times injections really help to get you moving, and they allow you to do what's needed to correct the actual cause. So they're a good adjunct to treatment, but you can't just get an injection and think you're going to heal your shoulder. It's going to come back unless you address the cause. And same thing with surgery. Any surgery that you do with the shoulder, after the surgery is done, the structural issue may be fixed, but you're still going to have muscle tightness, you're going to have poor mechanics, and you're going to also have to deal with the impact of what the actual surgery caused to the joint. You're going to have to heal from the actual surgery. So we really do recommend a combination of manual therapies, exercise, and fitness to correct the cause of your shoulder pain. This is also going to give you the best chance to prevent re-injury and function well long term. So what do we mean by manual therapies? This could be massage, dry needling, or manual stretching and joint mobilization. So massage is just rubbing out the tissue. Typically, when we talk about tissue, we're talking about muscles. So when muscles are tight around the joint, we massage them, loosen them up. It creates more blood flow and helps those muscles function better. Dry needling is very similar principle as massage. Think of massage as exterior, working on the muscles from the exterior. Dry needling is working on the muscles from the interior. So we can stick a needle into the muscle, which passes through the skin, and we can loosen up and relieve that trigger point. If there's any trigger points in the muscle, right then with the needle, it's much less painful than massage can be, and it's our quickest way to reduce muscle tightness, increase blood flow, and fix any joint restrictions that we have. Then you have manual stretching and joint mobilization. So manual stretching is just someone else taking your arm through a range of motion. It helps you relax a little better than stretching on your own. And then we have joint mobilization, is moving the actual joint to fix the mechanics of that joint. Like I said earlier, the shoulder is a big ball on a small socket, so it has to roll and glide. And if those motions aren't being performed correctly or the joint is stiff, we can take our hands and through different techniques, we can get that joint moving in the right way. Exercises typically focus on a few things. One is upper back and pec mobility. So upper back is your thoracic spine. Like I said earlier, you need good mobility in your thoracic spine for that shoulder and that shoulder blade to function properly. And then on the opposite side, you have your pec. If your shoulders are really rounded forward, it's going to cause a lot of tightness in your shoulders, and then your posture is going to be limited. So we need to make sure you have enough mobility in your pecs and the front of your chest in order for you to get into the right posture. So we work on mobility for the upper back and the pec. We also work on range of motion and flexibility in the actual shoulder joint. On top, those are kind of the two ways that we work on motion. The other way we work on strength. So rotator cuff and upper back postural strength. So we want the rotator cuff and muscles that directly affect the shoulder to be strong and functioning properly. And then we want the muscles of your upper back and thoracic spine, the ones that attach to your shoulder blade, to be strong and working correctly, because that'll help with the mechanical aspect of your shoulder pain. And then once we get you moving properly and we fix all the stabilizer muscles and the baseline strength that you need to function properly, we build functional strength with bigger movements like pushing, pulling, and lifting. So just to recap, it's not just working on the shoulder itself. We have to work on the upper back and the pecs. We have to work on range of motion. We have to work on strength. And something that's not included in here, we also address any cervical issues that you're having. Because if your head is very far forward and your neck is tight, it's going to affect your posture and position of your shoulder. So we may do some cervical stability and cervical motion. But a lot of times, if you're having neck issues or tightness in your neck or lack of motion in your neck, if we address the thoracic spine and the pec, that kind of clears it up on its own as well. So that's kind of what we focus on with exercises. This is these are two examples of upper back and pec mobility. So this first exercise here is just a foam rolling your upper back. So if your upper back or thoracic spine is tight, we put you on a foam roll and you'll just roll back and forth. This will help loosen up your back and then help you gain more mobility in that area. And then this exercise here, it's just laying over a foam roll. This is a pec foam roll stretch, and by laying here with your palms facing up, we open up that chest, and it's just a gentle way to stretch the front of your chest to help you get into a better posture and function better. So the next two exercises I wanted to show you are examples of what we do for shoulder range of motion. This one here is something that you can do to work on flexion or the ability to lift your arms overhead. It's just taking a stick and lifting your arm overhead. It's very light and easy. I'll show that to you again. So you're just laying on your back with your knees bent up. You take a stick and you hold it shoulder width apart, and you just reach the stick back. This next one is for internal rotation. Just lay on your side with your arm perpendicular to you and use the other hand to push down and rotate that forearm to the ground. Then you just hold that stretch. The next two set of exercises I want to show you are rotator cuff and postural exercise. So an example of a rotator cuff exercise is just a side lying external rotation. And we would progress the weight there. And then you're looking at this one here, laying on the ball, lifting your arms straight out to the side. So we're really focusing on strengthening your scapular or postural muscles with that one. So some examples of functional pushing and pulling would be a TRX row for a pull. That's what that one looks like, but we're focusing on this area here, working those shoulder blades, and then a push-up, of course. But we would progress you up to a push-up. There's a lot of things that have to happen before you can do the TRX row or the push-up. So after we get you moving correctly and we progress your movement and you're building functional strength, we need to teach you an individualized fitness program so that all that work doesn't go to waste and you're able to maintain the gains and continue to improve your movement and improve your strength. So we put here an individualized program to improve overall strength and maintain function long term. This is what's going to create durability and prevent re-injury. It's also going to address any poor movement patterns that may have predisposed you to the injury in the first place. So a lot of times, like I said, it's not just the shoulder, it's what was going on in the upper back. Maybe you had some core weakness, and addressing core stability is going to help your shoulder function as well. The body works as one, so you really have to address the body as a whole in order to get the result you want. So what does successful treatment look like? First off, we like to see that the pain is gone and it's no longer interfering with daily or recreational activities. You should be able to perform day-to-day activities and not have to, be afraid that your shoulder is going to hurt. You want to have good mobility, strength, and movement. So just because you're not having pain with your activities, if you don't have good mobility, strength, and movement, like we talked about before, the pain is going to come back eventually, or you're going to be limited in the activities that you're able to do. We also, like I said before, we want you to be able to perform a personalized fitness program to prevent re-injury and sustain long-term health. So learning that fitness program and being able to perform that on your own and understanding how to progress and regress exercises is important, not just for shoulder health, but for overall health. That's the last step that we want you to see, and we really make sure that people understand their personalized fitness program and understand how to progress and regress exercises in order to maximize their health. So after this presentation, if you really want to get your shoulder pain fixed, we want to offer this to you. It's a chance to come in, talk to a shoulder pain expert, have them look at your shoulder and see if we can help. If we can, we would recommend, the going through our program and teaching you how to mobilize your shoulder, your T-spine, and then strengthen the rotator cuff, scapular muscles, and progress to a fitness program. We are offering you a chance, as we call it, a free discovery session. So if you are interested in that free discovery session, if you want to really get ahead of your shoulder pain now and get back to normal, you can just text shoulder to 614-423-4515. This is a no obligation free session where you get to talk to a shoulder pain expert. They'll evaluate you and give you a plan for getting back to normal as fast as you can. One last thing I do want to mention is if you do have shoulder pain and you're considering or you're making a decision whether to talk to someone and get this fixed, I just want to let you know the longer you do wait, the harder it is to heal your shoulder. The biggest mistake that we typically see with people, whether it's shoulder pain, knee pain, back pain, is that they wait too long. And by waiting too long, muscles get tighter, weaker, poor posture sets in. You develop bad movement patterns and bad habits, and the more bad habits and more bad movement that you have, the harder it is to correct. If you get your shoulder looked at and get addressing these dysfunctions quickly, it's much easier, and the time spent healing and getting out of pain is much faster. So I just wanted to leave you with that. Once again, if you want to set up a free discovery session, just text shoulder to 614-423-4515. Hope you found this helpful, and look forward to hearing from you. Thanks.